Hello, I'm Dr. Barry. I'm a board-certified plastic surgeon here with Wake Plastic Surgery. Today we're going to be talking about some frequently asked questions related to some common facial rejuvenation procedures. We'll be talking about face and neck lifts, brow lifts, and upper and lower eyelid lifts or blepharoplasties. So a brow lift is a surgical procedure that aims to correct sagging eyebrows, one of the effects of aging. And so it does this through a number of different techniques with a goal for elevating the eyebrow position to give you a more refreshed look around your eyes without changing your natural appearance. So a brow lift is a lot less invasive than how we used to do them historically. The most common way now is through hidden incisions within the hair that can powerfully raise the eyebrow position. But there are many different ways to do a brow lift depending on your anatomy and goals. Some are more extensive than others, and during your consultation, we'll see what is most appropriate for you. So that is very common for you to have both what we call ptosis or descent of your eyebrows and your upper eyelids. What we find is that if we correct just the eyelids without correcting the brow descent or ptosis, then usually that becomes more noticeable after that surgery and becomes more complicated to address at that point. And so it's important to identify that situation so that those can be addressed together. However, if you have isolated sagging brows or brow ptosis, then that can be addressed with just a brow lift. And similarly, if you have isolated excess upper eyelid skin, then that can be addressed without addressing your brows. A brow lift is actually often combined with blepharoplasties, facelifts, and facial fat grafting. One of the benefits there is that you can address multiple different areas affected by facial aging and share a single recovery. I'd say most people feel comfortable returning to work within a week. You may still have some tightness, some mild bruising or swelling, but usually that can be concealed with makeup, and most people find it's improved to a point where they're comfortable going back into social situations, and especially if their work is not strenuous, usually they're comfortable going back sooner.